Every minute matters in an emergency, yet today, families often arrive at hospitals without knowing what lies ahead. Long queues, overwhelmed departments, and uncertainty at the very moment clarity is needed most. Lumine is a real time emergency care clarity platform that brings together live ER wait times, severity load, specialist availability, and triage flow across NSW hospitals, helping people make faster, safer decisions when it matters most. Lumen is shaped through collaboration. Hospitals, clinicians, digital health teams, councils, medical software developers, and university research groups each contribute their expertise. Together, they form a network united by one goal, making emergency care clearer, safer, and more predictable for every family. To understand how people experience emergency care, I gathered data from 30 community members through a custom designed Lumen community need assessment. The survey explored how uncertainty affects decision making, what the community wishes they knew before seeking medical help, and whether greater real time clarity would meaningfully improve emergency situations. The results were unmistakable. 86.7% said they do not know how long they will wait in the emergency department before being attended to by a doctor or appropriate carers. 80% said live wait times would make them more confident choosing a hospital. 83.3% said knowing how many severe cases a hospital is handling would influence their choice. And 100% said specialist availability should be visible during emergencies. People want clarity, they want confidence, they want information before they leave home. But numbers alone don't capture the human cost of uncertainty. Behind every percentage is a real person, a real family, and a real moment of fear. I know this because my own family lived it. When I was 10, I developed a fever that wouldn't break. After 2.5 days of trying everything at home, my grandparents urged us to seek medical help. As immigrants still new to the country, my family didn't have a car or a clear understanding of how emergency care worked. We had no insight into which hospitals were busy or which might see me sooner. We eventually made our way to the Children's Hospital at Westmead, arriving at around 10:30 that night. After triage, we joined dozens of families in the waiting room. Midnight became 1 a.m., then 2 a.m., then 3 a.m. Each time my parents tried to understand how much longer it might take, they were met with uncertainty. I lay half in my mother's lap, half on the cold metal railings, feverish, exhausted, and barely conscious. By around 4 a.m., after hours of waiting with no clear indication of when I might be assessed, my parents faced the difficult decision to leave, formalized only after signing a document acknowledging that my condition had gone unchecked for more than 4 hours. And this isn't just my story. What happened to my family is echoed across NSW. The challenges we faced are not isolated, they reflect a much broader pattern that experts have been warning about for years. Across NSW, emergency departments are facing pressures never seen before. Dr. Catherine Austin, president of the AMA NSW, warns that the rate of urgent patients seen on time have fallen from 76% to 69%, and only 57% of emergency visits are completed within 4 hours. Dr. Stephen Gurley, president of the Australian College of Emergency Medicine, reports that 31% of patients needing admission wait more than 8 hours and 90% wait more than 15, delays linked to higher rates of morbidity and mortality. Together, these realities reveal a simple truth. Clarity saves time and time saves lives. When families know which hospital is overwhelmed, which has shorter waits, and which specialists are available, they make safer decisions. Hospitals distribute demand more effectively, reducing overcrowding and creating a more predictable emergency care experience. That is the value Lumen delivers, not just efficiency but dignity. Every informed decision saves time, reduces risk, and strengthens the healthcare system. Lumen stands apart as the only platform combining live wait times, severity load, specialist availability, triage flow, and multi-hospital comparison within one unified emergency care network. Imagine a future where every person in NSW knows exactly where to go in an emergency, instantly, where every hospital is connected, where every specialist is visible, where every triage level is clear, where families feel confident, not confused. Today, you've seen the need, the evidence, and the impact. Now let's work together to bring Lumen from prototype to practice.